So there is a huge disparity in Alzheimer's disease between African Americans and whites. So the prevalence is 19% for African Americans and 10% for whites. So there's definitely something contributing to that. In terms of sleep, there has been a lot of research where it shows that African Americans typically report poor quality sleep. And we also see that they're getting actually less time objectively in that slow wave sleep, in a slow wave sleep stage, which is really important for cleaning out a bunch of junk in your brain. It's when your brain does house cleaning, and it actually cleans out the Alzheimer's pathology, which is the amyloid and the tau. And during that slow wave sleep stage, if you're not getting that much time in that in that stage, your brain is clearing out less of that amyloid. Um, and so we know that that is a physiological risk factor. We also know that most risk factors for Alzheimer's disease are illnesses and conditions that are very common in the African American community. And these things also directly affect your sleep. So I'm talking hypertension, high cholesterol, diabetes, obesity. All of these things are directly related not only to your sleep health, but also your risk for Alzheimer's disease. African Americans are also have a higher prevalence of sleep disorders and just overall disrupted sleep, so fragmented sleep, issues falling asleep, things like that. One of the common ones is obstructive sleep apnea. And what are the risk factors for obstructive sleep apnea? Hypertension, high cholesterol, diabetes. Obesity is a really big one for obstructive sleep apnea. And one thing that we do know is obstructive sleep apnea is highly underdiagnosed, specifically in the Black community, because a lot of people just don't think it's that big of a deal. A lot of people don't know that they have it. And there has been some research recently done actually at NYU that has shown that obstructive sleep apnea, if you have Alzheimer's disease, can make your Alzheimer's disease symptoms worse. So these are just a few of the things that are really related to sleep and Alzheimer's and how they can impact the Black community. So a lot of my work has to do with prevention of Alzheimer, the onset of Alzheimer's. And realistically, Alzheimer's disease is in your brain about 10 to 15, I mean, no, 15 to 20 years before you actually are diagnosed, before any diagnosis or symptoms occur. And so a lot of my research is focusing on how we can identify the disease in African Americans, specifically during that 15 to 20-year phase, right? Because once you have reached the point where you've been diagnosed, it's pretty much too late. There's nothing more that we can do. You've already lost enough brain mass, enough neurons to there's really no going back. You can't get back neurons that have died. So what I'm really excited about is being able to use at-home sleep monitoring, which is a lot of what my work focuses on, to be able to identify different sleep metrics and different sleep characteristics that may be trigger signs for development of Alzheimer's disease. The idea is to find a good, cheap and resourceful way to identify Alzheimer's disease within a good amount of time, so we can try to stop the development of the disease. So that is what I'm most excited about.